For armoring, we use Hylual 2.2% concentration, 2 milliliters. As our armoring area also includes parotic areas, we will use 2 milliliters of product for each side. The first step, Hylual 2.2%. The second step. The third step. The fourth step. Armoring is performed with 2.2% concentration of the product in linear technique. There are 3 lines, starting from the mouth angle to the anteloboium. The linear technique is performed intradermally. When the needle penetrates into the skin, we inject the product and leave it there. The technique is linear and retrograde. The next shot. The needle must be exactly in derma and must not see the needle itself. The channel is being filled with the product. This procedure can be more unpleasant for patients than the papule one, but here the result is faster and more obvious. It's because the higher concentration is used, the quantity of the product is bigger, so the lifting effect is obvious right after the procedure. After the procedure, we may see spots of microhematomas, but it's not very common. Draw back 1 centimeter from the first row and start the second one. At the beginning, the lines are parallel. But when moving to the top, all lines must converge. We see blood appearing in every shot. It means that we are in the derma. There are no big vessels in the derma. That's why hemorrhage is impossible. We see clearly where the needle is. It is in the derma. This line is also directed to the anteloboium. Now create another line, which is parallel to the previous one. We started at 1 centimeter higher than the first one. We make a shot covering the nasolabial folds. When removing the needle, inject the product. This patient has a thick skin, so there's no particular line prominence. The prominence can be seen in the thin skin, but in this case we will receive a very good result. All the rows are visible. They are directed to the top. All 3 rows will converge. This converged spot can be either at the hairline, the antelobium and parotid areas will be treated separately. All 3 lines converged. To create a link between them and more solid a frame, we change the needle direction, turn the head towards us, and create the columns between the shots, which will significantly improve the dermal frame. Make a shot with the retrograde movement, fill in the channel. In such manner, we create so-called reinforcing ribs in the derma. We clearly see how everything is being filled. We create the intradermal frame. The main rule of the procedure is to place the product into the derma. We can judge if we're in the derma by what we see on the skin and how the needle is moving. The derma has resistance, so the needle must overcome it. The lip area and the nasolabial folds are well supplied with blood. And as I said before, armoring can cause formation of the microhematomas. That's why when we're working in the derma, of course we damage some small vessels. And so it's normal if small bruises appear after such procedure. Now, all lines are connected. Treat the skin with Decocin medical product. After the procedure, we apply Daily Deluxe spray, 2 to 3 sprays, from a distance of 25 to 30 centimeters away. On the opposite side, we make the same lines from the mouth angle to the hairline. The first one is done. Turn the head, draw back 1 centimeter down and make the second line, a parallel one. This procedure is recommended to use with those patients who are familiar with papule technique, as the procedure itself is well tolerated by patients, but it can cause the formation of microhematomas. The next line is 1 centimeter higher. And just like on the right side of the face, we make links, the perpendicular lines. The shot is made from the bottom to the top, and when removing the needle, inject the product. So, the framing is created, and it defines our term armoring. The product must be injected from the bottom, but injection from the top is also possible. Anyway, the product will stay in the position you've injected it in. For example, now I'm injecting it from the top. The needle puncture is not important at this moment. The presence of hylual in the derma is important. For example, on the left side of the face, it is comfortable to create lines from the top. Now we've made the connecting strips of armoring frame. We've finished the procedure. After the procedure, we apply Daily Deluxe spray, 2 to 3 sprays, from 25 to 30 centimeters away.